I'm here with Dan, a patient that has had a couple of shoulder surgeries, and for his first shoulder surgery, he went to a physician-owned physical therapy practice, and for his second shoulder surgery, he went to an independent practice. And Dan is going to share with us his experiences at the different clinics and kind of support a lot of the clinical information that is out there with respect to the substandard care that's provided in a physician-owned physical therapy practice. So, Dan, thank you for joining us.
Not a problem.
And so, Dan, give us a little background. You had a surgery on your shoulder, about how long ago was that?
It was 3 years ago.
About 3 years ago, and then
my first surgery. Yeah.
Right. And then after that surgery for a rotator cuff problem, you went to a physician-owned practice. Is that correct?
Yes, that is correct.
Yeah. And can you tell me how many patients, when you were there, how many patients were with you in that practice being treated concurrently?
Around 30.
Around 30. And about how many care providers in that practice were there along with those 30 patients in any given time frame that you were there?
Probably not more than 10.
10. So the ratio then was about 10 care providers, both licensed therapists and unlicensed providers to 30 patients. So like a 3-to-1 ratio, patients to clinic care providers. Is that correct?
That's correct.
Okay. And you mentioned to me when we first discussed your story that one of the biggest problems you had was the lack of supervision. And can you tell me, you said something about after your first couple visits with them, they left you on your own. Can you elaborate on that a little bit for me?
Well, they basically would give you some weights and just tell you to do your exercises. The ones after the first two, they would show you, and then after they would just leave the weights and say, "Okay, do your exercises. I'll see you in a half hour or so."
I see, and I think you mentioned to me that there were support staff, not necessarily physical therapists, but support staff that were not even present when you were doing those exercises, and they were off somewhere else. Can you verify and elaborate on that?
Oh yeah, that kind of really upset me because I could see them just talking to one another, and at times I wouldn't even have enough weights, and I would go and get my own weight. It was really upsetting.
So you said at times you would even go get your own weight. So then it's conceivable that without either a physical therapist or even an assistant or aide present, you could have grabbed the wrong weight. Is that accurate?
That's accurate.
And would you say that the relationship or the supervision of care at this practice was good, average, or poor?
Poor.
And I know that you've also been to an independent private practice, and we'll discuss that in a minute, but comparing that experience in that physician-owned practice and the supervision compared to this private practice that you've gone to, is the supervision much better in the private practice?
Than what?
Than in the physician-owned practice?
Yeah. Oh, definitely.
So then the continuity of care, or making sure that you're doing the right things for your rehabilitation, you would say that is better in the private practice, correct?
Yes, correct.
Very good. I know during your care at that physician-owned practice, oftentimes they would use some modalities like ice and electrical stimulation. Can you tell me about some of your experiences? I think you mentioned several times some things happened at the POPTS, the physician-owned clinic. Can you tell me about that?
Yes. At times, they would maybe go to lunch or go somewhere, and at least 5 times I'd have to call somebody to tell them that I needed to take it off. That they were either going to lunch or maybe even forgot about me. It was very upsetting.
So then, again, there were times when you were put on some treatment modalities, ice or electrical stimulation,
Right.
and they just plain forgot about you.
Yeah.
Right. So with respect to the number of visits to that practice, that physician on physical therapy practice, I think you mentioned to me that you had somewhere between 24 and 30 visits to that practice, but you weren't quite sure. Is that correct?
Yeah.
Okay. Very good. So you had unfortunately a problem with your other shoulder too, and it sounds like you had a surgical procedure on that one, correct?
Correct.
And you were so dissatisfied with the care provided at that surgeon's physical therapy practice that you went back to your primary care doctor and asked for a referral to a different practice. Is that accurate?
Yes.
Okay. And that physician, that primary care doctor, ended up referring you to an independent private practice, correct?
Correct.
And tell me a little bit about how many patients that practice was seeing, or the ratio of care providers to patients in that practice.
Well, that one, the care was fantastic. It was like for 3 patients, they had 2 providers. It's more relaxed, more comfortable.
So it sounds like they had twice as many care providers per patient. Those care providers are always there supervising you with every exercise versus being off, talking to each other, or being somewhere and leaving you alone or forgetting about you. Is that correct?
That's correct.
And so given the choice between the two, it sounds like you prefer the independent practice. Is that true?
That's so true.
And whether you're paying out of pocket or your insurance company is paying the money for this care, in which case do you feel that the insurance company is getting a better value when they're paying for your therapy?
Definitely the private.
The private practice then is the better choice. Okay.
Way better, yes.
Do you feel like there's a better relationship with your care provider at the independent practice? If something were to go wrong, do you think they would be there and they have a better personal relationship with you to make corrections or understand what's going on with you?
Yes, I do.
Okay. And were you ever left alone on modalities in the independent practice?
No, never.
No. Okay. And is there anything else that you might like to add?
No, again, this is my second time at a private practice, and I recommend it to anyone, and that's about it.
Did you feel that your physician had his best interest at heart when he was referring you to his practice, or did he put your care above the profits that he was making at his practice?
I really can't answer that, but I don't know, but I think it was easy for him to just, send you down the road to his specific, his own therapist.
Sure.
I don't know. Yeah, I don't think that's the second doctor. I don't think he really cared that much.
I see. So then what you're saying is that you don't felt the physician that did your surgery and sent you to his practice cared as much about the outcome of your surgery. Is that accurate?
Well, I think he hoped that the surgery would go well, but he doesn't really know or deal with his physical therapist. If that makes sense.
Sure, that makes sense. Did you ever see your physician or any of the other physicians in the physical therapy practice while you were there for that 24 to 30 visits?
Never.
Never. Okay. So would you agree when I said that physicians make the statement that they like to have their own physical therapy practice so that they can keep close tabs on their patients and their physical therapists. That statement is not accurate.
That is not accurate.
Very good. Okay, well, thank you very much, Dan, for your testimony here today about your experience in both a physician-owned practice and a private practice. And we appreciate it very much and certainly wish you very well in the recovery with your most recent shoulder problems.
Okay, thank you so much.
Thank you.